I'm Mara Masumi. I'm a researcher at UCL working on the DIS project, and this is Shivali Moda, our patient and public representative. We're going to talk a bit about the patient experiences of digital health. Shivali, could you tell me why it's so important to include the patient perspective?
For me, as a South Asian woman, and having lived with the conditions of diabetes and high blood pressure, hypertension, and having seen it in my community and in my family, and lived with that condition myself, I noticed that there was a very limited uptake in the community for digital interventions whilst I was using them and I was benefiting from them. So for me, it was really important to have a voice and an understanding about why not everybody is able to access it or to be able to use it. Or sometimes people were not even interested in trying it because it sounded like something new or something that they didn't think they would be able to do. I've used various tools in helping me with my conditions, and I was really interested in having that voice to say, you know, this is how it helps me and this is how it could help you too, and build it into the community and have those discussions with people through this study and see if we can help people.
Thanks for sharing your experiences. We spoke to people from a South Asian background from across the UK. People use digital health tools for a range of their health needs. The first one was information access, so looking at websites or sharing information on social media or via messaging. The second was to do routine health tasks, so booking GP appointments or repeat prescriptions using apps or websites. The third was managing their own health at home, so using the tools available to help them modify their diet or to keep track of the exercise that they were doing. And the fourth way was to stay in contact with their health and care team, so using digital health tools to have a consultation remotely or for their health and care team to be able to keep track of their measurements such as their blood sugar.
And with that, they're able to share that information directly with the surgery and they're then able to have a conversation, right?
Absolutely.
So I think what we found as well is that during COVID, when they weren't able to actually go into the surgery and get help, the digital tools were used more frequently, but people found that there was a bit of anxiety around the using of those tools because then they weren't able to interpret it and felt anxiety about what those numbers might mean. Is that something that you saw as well?
Yeah, well, that's definitely what we had from some people, that they stopped using or they didn't want to use those kinds of tools because they were worried about not having the skills to interpret the numbers. But we also heard a variety of other reasons why people didn't use digital health tools. So it might be that they didn't know that they were available or they hadn't been offered to them or weren't available in the health service in their area.
So sometimes I guess funding is an issue and sometimes it's just not available or in that borough, is that right?
Yes, that's right. So there's a variability across the country in terms of which tools people can access where through their health service. Other reasons that people said that they hadn't used or were afraid to use digital health tools were that they weren't sure about, they lacked the confidence or they weren't sure about having the right skills to use digital tools, fear about not being able to interpret the results or having inaccurate information, but also that digital tools weren't always designed in a way that was useful for them. For example, information on diet didn't include South Asian foods.
Yeah. I guess there's also the element of shame where South Asians, especially in the elderly community, there's always this feeling of, oh no, I don't want to ask for that information or that tool, or this idea of do I deserve it, or is it something I'm entitled to? Should I even ask for it? But even as far as the skills go, sometimes the skills aren't there, and the ability to ask for help in learning to use those things, I think, is something that's missing. I found communities were really helpful in encouraging people to take up tools like, to be able to communicate with each other during COVID, but also with the medical profession to be able to get their prescriptions, like you said, or share their medical data, the readings that they've taken, share them and get help. I guess increasingly communities could help with the skill side of digital interventions.
People shared that their shame at not being able to use digital tools is one of the reasons that they weren't able to use digital tools during the pandemic. And as you say, for some people, the community was a really useful resource in terms of having people to be able to help them learn how to use them and learn what's available. People suggested during the study that using community organisations or community resources could be a really good way to learn about the risks and benefits of digital tools, as well as being able to learn the skills they need to use them themselves, and that those might be useful in areas outside of health, such as social services or education.
And I guess the future now looks like a happy medium where people want to be able to use the digital interventions, but also have access to the professionals who help to interpret that information. And I think that gives people confidence that actually, they're not on their own in dealing with this information that's kind of coming through their device, whichever one they're using.
Absolutely. And I think going forward, it's really important that we support people who are interested and curious about digital tools, and we make sure that services are available for people who maybe don't ever want to use digital tools. And the learning from our study could be applied to other groups who might face the same barriers in using digital tools.
I agree.
In the next video, we'll learn more about the experiences of health and care professionals, technology developers, and national organisations, and their role in making health technology accessible for all.